E.S. Grant Mental Health Hospital in Monrovia, Liberia is the only inpatient mental health facility in the whole country.
This is where patients come when their families can no longer care for them in their homes. We have about 35 to 40 patients at one time.
Care for 35 to 40 patients in a country of nearly 4 million.
They have groups with the occupational therapist.
Hospital Administrator Rodney Presley and his staff are committed to providing patients with the best treatment possible. But their resources are limited and the country has a massive shortage of mental health workers.
We have no doctors on staff, with there not being a psychiatrist on ground. Our nurses, our physician's assistants, they've done a very good job.
Producing more mental health workers to do a very good job is a top priority for the Carter Center's mental health initiative in Liberia. Grant Hospital will be one of the training sites.
The first strategy we have in conjunction with the Ministry of Health is really to expand the workforce capacity. Our target is to train 150 nurses and physician assistants to develop the capacity in the country to be the backbone for mental health service delivery in the country. Then we're also working on policy, so we want to make sure that, for example, when nurses go in the field, there are drugs in the national drug supply that they can prescribe. So we're working with the ministry to support them as they develop their drug list for psychiatric practice.
This is the pharmacy here.
Presley is all too familiar with having an inadequate supply of medication for the 700 to 800 outpatients who come to Grant Hospital each month.
Oftentimes, we have psychiatrists that come in from the States who want to treat patients with medications that are not available in the country.
It comes down to this. Without prepared and trained mental health workers, no drugs, clinics, or hospitals can adequately serve the Liberian population. Janice Cooper envisions a Liberia where the mental health services are in good hands.
Registered nurses and psychiatric physician assistants will have the capacity to manage mental illness, to be able to assess, to be able to diagnose, to be able to treat, to be able to manage medication, and to be able to refer where it's appropriate to more intensive inpatient facilities.
Facilities like Grant Hospital, where the resources may be limited, but the respect for patients is not.
They're just normal people who have mental health problems and are coming in for treatment and rehabilitation. They talk to me about basketball, their relatives who live in the States. Others tell me about their life here in Liberia.